Welcome back to the Retirement Report. I'm Hank Parrott, your host. Joining me, Warren Cranford. He is a benefit advisor, benefit specialist, if you will, with Medicare, or not with Medicare, but for helping people with Medicare. And I'm going to delve right in because we want to get as much information out to you today as we can, and in particular, some of the decisions you're going to have to make. And it starts with understanding how Medicare works. So let's start with Part A and what Part A covers, Warren.
Yeah, Part A covers your hospitalization. It covers skilled nursing facility care up to 100 days if you go to the hospital and you're admitted and you stay a certain amount of time. You have benefits that are covered through Part A. It does cover hospice care. Does not cover long-term care for folks that may need an assisted living type setup or memory care, that kind of thing. But that's the typical coverage of Part A.
Yeah, and this is one of the things to understand the long-term care piece of this in particular. Long-term care is not covered. As I said, they'll cover if you've been 3 nights in a hospital. They would cover rehab. So let's say someone has a stroke, they're hospitalized. Then after being stabilized there, they're moved to a rehab facility, and that's where, as long as they're showing improvement through physical, speech therapy, different treatments they're receiving, that would be covered up to 100 days. And again, we got to stress up to 100 days. It's not a guarantee that you're going to get the 100 days. Again, it depends on your care that you're receiving, the level of care, and whether they determine that it's still something that you need and that you are, in fact, also showing improvement through that care. If you do get sent home, and as Warren was just saying, long-term care, meaning in this situation we'll say custodial care, is not covered. So if you were at home and you needed a physical therapist or speech therapist to come to your home, that would be covered under Medicare. But if you're just having someone come in because you're not able to do things for yourself, and they're doing some light housekeeping, fixing meals, running errands, taking you to the doctor's offices, doctor's visits, those kind of things, that would not be covered. So that's when you get into long-term care policies, it's also important to understand that and how that might work with regard to Medicare. So when it comes to long-term care, Medicare is very, very minimal in terms of what they might cover. Now, Medicare Part A, as Warren was just talking about, there's no premium for that one. You'll have deductibles and co-pays depending on and again, if you've worked, you can see here on our screen that if you've worked at least 40 calendar quarters or 10 years, then there's no cost to that. And you can see, though, if you had less work experience, then you might have some cost per month for your premium, but that's unusual. Most people have worked at least 10 years that qualify for Medicare. Then we get into Warren Part B, and let's talk about what Part B covers.
So Part B, and let me just reiterate again, this is original Medicare. Yeah. So there are some differences and benefits that may come along with Part C, Advantage plans that build on top of what original Medicare would provide. So Part B is outpatient care. And as you see on the screen there, obviously doctor and physician services, ambulance services, durable medical equipment, outpatient services, preventative benefits like annual wellness checks, mammograms, bone mass. There's a lot of screenings that original Medicare actually covers. Quite a few of the list is pretty extensive, which is good. And so that's the makeup of Part B. Part B.
And typically you're going to get those kind of things. If you go in, basically, think about it. You're going to go to, practically speaking, you're going to go to your doctor. You hopefully get annual physicals, especially as we get older. It's important to do that, to get those different screenings. And whether that's mammograms, whether it's colonoscopies, whether it's screenings for cancer, cardiovascular disease, diabetes, all the different things that, doing blood work and the other tests that they might do to screen for those things and make sure that you're okay, that's all covered under Medicare Part B. Now, there is a cost, though. Unlike Part A, where there's no premium, here with Part B, Warren, we do have a premium cost.
Yes, correct. So with original Medicare, you have the average, I'd say average U.S. citizen that is eligible for original Medicare, their Part B premium in 2022 is $170.10. And now this is paid if you're receiving Social Security benefits. It's deducted from your Social Security check. If you aren't receiving the benefits at that time, then you are personally responsible, and you will receive the beneficiaries receive a bill from Medicare to pay that premium, and so.
Yeah. So if you're already on Social Security, it's likely to deduct. If you're on Medicare and Social Security, you are well aware your premiums are being deducted from your Social Security benefit. Now, look at the screen, Warren. This is one of those where for most people it's going to be that $170 a month, but for higher income earners, and it shows on there, for instance, for a married couple, married income in that $182 to $228,000 range, you would pay an additional $68 per month. If you make over $228,000 as a couple, then basically your premium is going to be doubled. You're going to pay $340 a month, and so on. So here's that part of it. High income earners, you can expect this type of means testing. This is something that was added in some years ago to the Medicare system, and we see it in other areas with Social Security and that as well, whether it's taxation of your benefits, or if you're taking Social Security early, it may be a reduction in benefits based on how much money you make. So we're going to see more of that kind of means testing where the higher earners, and I think it'll get to where even higher, those with higher assets are also going to be affected by that. So the other piece that goes into this isn't so much that this isn't so much a surprise. Where people get caught short, Warren, and like have you talk a little bit about it, is this IRMA, this income-related monthly adjustment amount, where someone might sell a house. You know, if you had a rental property, not as likely with a personal residence, because for a married couple, you've got a $500,000 exemption. So if you bought a property for $500,000 and you sold it for $1 million, there's no tax on that. That $500,000 gain is exempt. However, some people that have had farms and stuff where they sell them and they might have a gain even on a personal residence of over $1 million, that could certainly affect your premiums based on this IRMA. The other is if they sell stocks. So if anything that they have a capital gain on, and it could be just a one-year thing, and it typically is where I see that being the case, it's going to affect their premiums.
Yes, that's correct. So the chart in this chart is for 2022, and typically there are some adjustments each year that CMS.
So if that happens, let's say somebody had $100,000 or $200,000 gain, whatever it might be, and it doubled their premium. Is that, that's not a permanent thing, right?
Correct. That's right. Typically, it will last a year, and they're supposed to do a look back and a review. I usually advise my clients, if they fall under this category and face this type of and have the IRMA with their Part B premium too, after a year, contact the Social Security Department and ask about where a review might stand for them. And because, like you said, and I've got clients like that, Hank, that had 2 years ago, they had a significant income year, and their adjusted gross income fell in one of these categories, and thus they were hit with the IRMA.
So basically, and they look at your tax return. They're saying, okay, you had this big bump in income. They increase your premiums. The next year, when you file your taxes, if that income has come down, they should take that away. But as Warren just said, good idea to just call them and make sure that you don't get dinged for a second or third year on that premium cost. Now, the next thing, there are some additional costs specific to Part A and Part B. And let's take a look at those, Warren, what those are.
So additional costs that we're looking at for Part A are things like there's a hospitalization deductible, as you can see on the chart there, $1,556 is the amount you're responsible for this year, 2022. And that means if you're admitted and you're maybe in the hospital just one day, but if you're admitted to the hospital, that would be your responsibility under original Medicare. And then there's daily hospital copays. You can see there on the chart there on your screen. As you can see that after so many days, there is a daily copay or deductible you're responsible for, and they increase between 61 and 90 days, and between 91 and 100 days, 150 days.
And copays typically are ones that, copays where you're going in, you have to pay usually a flat amount. Co-insurance, on the other hand, is more. And copays typically continue on, like in regular, if you have regular health insurance through your employer, for instance, and you've got a copay, even if you've met your deductibles and your out-of-pocket, excuse me, not your out-of-pocket necessarily, but if you've met your deductibles and co-insurance limits, you may still be paying copays with many insurance policies. All things to understand, because one of the things I want you to really get from this is that out-of-pocket healthcare costs for a married couple age 65 in retirement average anywhere from $250,000 to $350,000 a year. Or excuse me, over their lifetime, not a year, God forbid, over their lifetime. So think of that. You know, have you thought about over 20 years in retirement, how you know, to have that out-of-pocket healthcare expense that you're going to have to cover, because as I said, it's not all covered. This one that Warren was just talking about with Part A and Part B, and this is where Warren, with a lot of these deductibles and copays, well, actually, before we get into that about Medicare Gap, Medicare supplement policies, what is the benefit period? Let's talk a little bit about that on this next slide.
Yeah, great. I'm glad you brought that up. So it's important when you see those copays and or deductibles that you're responsible for, it does reflect a benefit period. And so benefit period is when you're admitted to the hospital day one and you stay in the hospital for whatever period of time, and you have to remain out of the hospital. Once you return, you have to stay out of the hospital for 60 days. Once you're out of the hospital 60 days, if you have to go back into the hospital, then that benefit period resets. And you could be responsible for the deductibles and copays that you saw on the previous slide all over again. So as you, and obviously with that, what you will see is that if you had several incidences where you had to go into the hospital over a period of time during 1 year, it could get quite costly because of the deductibles and copays and things that you're co-insurance and things like that.
This is where Medicare supplement plans, which is where you advise people a lot in helping them not only with determining whether they need, whether original Medicare is better for them or Medicare Advantage. With original Medicare, what type of Medicare supplement plan might be best for them, and how those things work. So on this next slide, what Medigap plans cover, let's talk, because this is where you've got deductibles, you've got copays, you've got your Part A premium. If you take the prescription, you've got a Part D premium. So in addition to those, we're going to have a supplement plan.
Correct. So the Medigap or supplemental plan, those terms are used interchangeably. You know, a Medigap plan, it's a plan that covers the gap. So, and just to back up and say this and reiterate, there's no maximum out of pocket with original Medicare. So Parts A and Part B. Right. There's no ceiling. Which
all the more reason to have a Medicare supplement. In fact, we're going to have to take a break. Let me do this because I don't want to interrupt in the middle, and this is going to be an important part for everyone. So we're going to take a break. When we come back, we're going to talk about Medicare supplement plans in a little more detail. The different types of Medicare supplement plans, the different costs involved, and how they can impact your out-of-pocket costs, of course, most importantly. But first, we'll take a break. Join us here. We'll be right back on the Retirement Report.